So chemotherapy is a drug treatment. It uses powerful chemicals to kill fast-growing cells. And we know that cancer cells are the most fast-growing cells in your body. So there are many different types of chemotherapy available. It can be used alone or together with other types of agents to give the most effective control of cancer for you. Chemotherapy does have some side effects, and you can talk to your doctor about them and what to expect later. So chemotherapy can be given a few ways. The usual way would be an infusion, which basically means that we would insert a needle either into your vein in your hand or into a chemo pot in your chest and hang a drip, and that would go directly into your veins. The other way is pills or tablets. So prior to your chemotherapy, there are a few things that need to be done. So firstly, your doctor would do a few tests and preparations, mainly to check your bloods, your kidney function, your liver function, and any other problems that you might have, such as your heart function, hearing, and anything else. The other thing is, like I mentioned earlier, most chemotherapy is given as an infusion. So your doctor will have to make sure that you have proper venous access. So during chemotherapy, usually a small needle is inserted either into your hand here, or we implant a chemo pot in your chest. And what this basically means is that a chemo pot is a small device, usually plastic or metal, that is surgically implanted into your chest somewhere around here. And during chemotherapy, we would use a small needle to just poke through your skin, which covers the chemo pot, and this can access your chemo pot, and it saves you having to be pricked every time for chemotherapy. So chemotherapy can be done in the daycare, which means that you can just come in the morning, have your chemotherapy, and go back in the evening. It can be done in the ward. So this would require admission, and it's usually done if your chemotherapy is a long infusion, meaning that the drip will run over a few days. Or in the case of pills, it can be done at home. Okay, so in general, and this varies depending on the type of chemotherapy that your doctor wants to give you. Chemotherapy infusions are usually done every 3 weeks, usually for a total of 6 cycles. So that's about 4.5 to 5 months of treatment. Each chemo infusion can be from 10 minutes to about 3 to 4 hours long in general.